So going into treatment for headaches, we'd be treating a whole bunch of different areas of the back and neck depending on when your headaches is from, right? So we're just doing a general basic approach here. So we started our clinic with suction IFC. They don't go on with sticky pads, they go on with suction cups. We're gonna run that for 8 to 10 minutes with a heat pack on you just to get you all loosened up. That gets a lot of blood flow to the area and loosens up the tissue. After that, we're doing a thing called shockwave. It's a pneumatic gun. A bullet comes through the tube, hits this here. Depending on where the headache is coming from in your body, we'll work that area a little more. Let's say this patient is more of a traps issue, so up through these purple muscles in here. We're gonna run the machine like this. Probably both sides. If it's super bad on one side, we'll do the other side more. It's gonna hit you between 800 and 2,000 hits depending. Now, what we do with some patients is if it's really, really bad, we will run up into their neck. So with this, we're gonna get into here, and when we actually find the vertebrae that are a little bit bad, we're going to hold it there and really get it to beat up good. This helps make a way cleaner adjustment and breaks up tissue the patient can be having for a very long period of time. After the shock, we would be getting some ART with the patient, some deep mobilization. So essentially placing my finger deep into the musculature of the neck and moving it around. Now this can go anywhere on the neck. I can move up and down the vertebrae. I can get into your levator scap here. I get into your traps. If it's a rib that's out, we beat that up pretty much. All this is just used to loosen up the tissue and make the adjustment a little easier. This is probably actually a little bit more painful than the shockwave, but when I get that full range of motion with some active release, patients definitely loosen up really nice for the adjustment. Okay, the final step of treatment for headaches is going to be the neck adjustment and the middle back adjustment. So depending on the side of the patient where the neck is, we'd come in here, find the spot that's locked up and a little push through just like this. And then we do the other side in here, little turn. You can tell my patient was way more locked up on her left side. Now, after that, or before that in some patients, we would get that middle back. If it was your rib going out, rib adjustment's a little different, like in our other video. I'd find the spine, come off the side of the spine and hit the rib. But for the middle back, because most people's neck headaches are coming from tightness in the middle back here, deep breath in here and out. We just adjust the middle spine just like that.